About the consumers who are newly enrolled in an Obamacare plan. It looks like a very large number of them are now making another choice. A new report shows that Aetna expects more than 30% of its new ACA enrollees to decide not to spend the money for those premiums. Other major insurers are also seeing erosion. So what does it say about the future of Obamacare? Joining us now is CEO of Avik Health, Dan Mendelsohn, and Avik Roy of the Manhattan Institute. Thank you very much, Dan and Avik, for joining us. Avik, I would imagine that we would expect always a certain amount of attrition. So is there anything in these headlines that makes you worry?
Yeah, I would say the amount of attrition we're seeing is about in line. I think we all expected about 2 to 3% a month. That's pretty standard with these kinds of plans. The question is who's dropping out. If it's primarily healthy and younger people who've decided that these plans aren't a good deal for them, then we might start to worry. We don't have that data just yet.
We don't have that data just yet. When will we have that data?
Probably around in the next 6 months or so, we'd start to see what the premiums are being charged by these insurers. That will reflect how they're seeing the market evolve in terms of who's signing up, who's staying out.
There's going to be, as said, I think about 2 to 3% attrition, and it will stabilize out, and then you'll start to see more people signing up for next year.
Do you agree with that? It's going to stabilize out, and maybe we'll see more sign-ups next year.
Thus far, the data that we have, and it varies by state, is that the increase in premiums for 2015 is roughly in line for most states. In some states, it's not. In some states, we're seeing 15, 17% increases, but the typical state on average is about 7 to 8%, which is enough to keep the market going for next year and seeing higher enrollment.